Ladies and gentlemen, in addition to tonight's event, we are happy to announce the launch of the Coaching You Up campaign, a collaboration between USA Boxing, the American Society of Consultant Pharmacists, and the ADVC.
The Aging and Disability Vaccination Collaborative, or ADVC as we call it, was created through a grant from the Administration for Community Living. It was really in response to the COVID crisis.
When you look at the older adult population, they were the most devastated by the COVID pandemic. And it's not different for flu and other diseases that we have vaccines for.
It's to ensure that older adults and people with disabilities have the information they need and the access to those important vaccinations. The funding goes out to community-based organizations that are working at the ground level.
We reside in a very rural part of Ohio, and so access to education, vaccines themselves has been a barrier.
Building trust is very important to deal with the misinformation that's going on. In rural areas, we're going to their community in order to find these pockets of folks who need this information. I'm meeting them where they are. There was an elderly gentleman, he was scared to get the shot. But when I talked to him and told him about how many people we had vaccinated and how nobody had a problem, we were able to reassure him that he could actually get the shot and he'd be okay. I think that is a lot of the conversation that has to go on in community with somebody they can trust.
Today we are offering a free COVID booster.
Our partnership with ASCP started with the idea that we could provide information and choices and be able to provide vaccines at a boxing event. Because we are a generational sport, we have that tie-in.
We really feel like this is a unique opportunity. US Aging recognized the impact it can have on the Black and Hispanic communities that support USA Boxing. They recognize what the opportunity is for pharmacists to be in there educating and vaccinating. And that is really what this grant is focused on, is how do we get more older adults educated and vaccinated, and how do we meet them where they are?
Our grantees, they know their community better than anybody else. They know what will work as far as getting people to vaccine clinics, and they know what won't work. And so we've built in that creativity into this project.
We did a really fun thing called Boosters and Bingo. The atmosphere in which they are getting their vaccine was key, because they were having fun. There was lots of activities going on around them. And so, oh, I'm here, I'm having a good time, and this is important stuff. I'll go ahead and get my vaccine or get my booster. It doesn't have to be clinical. We need to offer individuals an experience and the education and the access that they need. This funding has really just opened doors and awareness that we wouldn't have had otherwise.
US Aging has been great. They've had phone calls, they reach out, we've had face-to-face meetings, talking about what's working, what's not working, sharing things with other partners, and really helping as a US Aging community to get people access to vaccines, to get people educated.
Supporting optimal health is core to our mission. What we're looking for is to ensure that everybody can age well, can live well with optimal health, dignity, and independence. And getting your vaccinations is key and critical to achieving those goals.